Hey guys, Dr. Galyardt here, and I just want to go over a couple stories with you today. Every week, every day, we get amazing people coming in, just from the stories and the issues that they've been having to the results that we are getting with them. So a couple that really hit home this week. One gentleman today in the 30-year-old age bracket, and just an amazing story of how he's gained 50 pounds over the last few years. His digestion is off, his energy is off. He's got no motivation for taking action on so many different things. And he's been through the ringer, and they've tried medications, and they've been to other doctors and tried so many different things, and yet no one has asked that underlying question of why. So it'll be so exciting when we see his brain map, when we see his blood work, when after we put it all together with exam, I'll have a much better idea of what's going on with that. But I always tell people I see just as many 20-something-year-olds as I do 50-something-year-olds. We had a lady last week, 37 years old, and we always ask people, what do you think will happen in 5 years if we can't get this figured out? You know what she said? She said, I think I'm dying and I probably won't be here. She has a couple little kids. It's just heartbreaking to see these things. Age doesn't matter anymore. We see people in their teenage years that are just as bad as a 70-something-year-old. So very amazing to see all these different stories, different people out there. One exciting one, we have a lot of patients that come from out of state. We have a lady coming over from Nebraska, about 2.5 hours away, and we are not even 2 weeks into the process. I saw her yesterday, and she is down 14 pounds. And you know what? We're not counting calories. We're not putting on her diet. We're not cleansing, nothing yet. All we're doing is starting out, figuring out her blood sugar, figuring out why it goes up, why it goes down. And you know what? When she went and ate a runza and french fries, guess what? It went up to 190. Yeah, not surprising, but once you see that, once you see it on that blood sugar monitor and it clicks and it makes sense, and you're like, well, good Lord, I'm never going to do that again. That's the awesome part. Her legs, when she came in, were so hard and thick. There was no sponginess to them at all. Now, 14 pounds down, she's got more spongy. She's got more energy. Her life is changing. We've had another patient. She's down 20 pounds in a month. And at first, when I saw her at 3 weeks, she said, oh my gosh, you know what? I'm not a patient person. I want to be losing more weight. I said, well, how much weight do you think it would be feasible to lose in a month? And she said, 20 pounds. I go, well, that's a lot to lose in a month, but you've already lost 15 in 3 weeks, and another 5 pounds in next week, and you'll be at 20 pounds. And she did it, and we're not doing a weight loss program. All we're doing is trying to get that body healthy. And remember, this is splitting hairs, but it's a very important point to remember, because most people have been taught you lose weight to get healthier. You lose weight for your cholesterol to change, for your blood pressure to change, but that's not it. You get healthy, so then your weight starts changing. You get healthy, so your cholesterol starts going down. That's what we've got to change, is the health of the system. I've got another patient. I always say we've never failed at getting somebody non-diabetic if they're diabetic and if they play the game. So what does that mean? Well, if they do what they need to do and we make the changes based on what their body is telling us, we have never failed at getting somebody non-diabetic. We have a gentleman now, he's in his early 70s. He's been on diabetes meds for 10 years. And guess what? After 6 weeks, his fasting glucose was actually too low. He started weaning off the drugs, and his doctor had no idea how to wean him off those drugs because he never had. If somebody goes on diabetes drugs in the medical model, they stay on that. So guess what? He had to wean off. He was able to monitor it, knew exactly when it was going up, when it was going down, and we're now 14 weeks into the process, and he is no longer diabetic. So we see miracles every day. You know, if you have any questions, any comments, any specific cases that you want to talk about, feel free to drop us a line. Otherwise, pass this information on to anybody that needs it. Have a great day.